Thank you for the opportunity. I'm Dr. Leo Zekeng. I'm the UNAIDS country director and representative for Tanzania. I've been in this position in this beautiful country since July 2017. So this is a little bit more than 3 years. And I really enjoy the work, the country, and then the people with whom I engage every day. Thank you for having me.
Thank you. We're looking at HIV and AIDS in Tanzania. What is the trend of this pandemic or this epidemic in Tanzania, say in the last 10 years?
If we look back if you look back the last 10 years, I can say the prevalence, which is the number of people infected in the general population, has declined from 7% to 4.8%. When we look at the people dying because of AIDS, that number also has declined by about 50%, which is good. When we look at the new infections, especially the numbers of babies born, with HIV, that number also has decreased. So this is really good progress in terms of the epidemic. But when we look at the UNAIDS data for 2019, in this beautiful country of Tanzania, about 60 million inhabitants, we had 1.7 million adults and children living with HIV and AIDS in this country. It makes Tanzania the third largest epidemic in the region, and HIV and AIDS remains a public health threat in this country. Just to give you further information, every week in Tanzania, we have about 1,500 new infections. Every week in Tanzania, we have about 430 people dying because of HIV and AIDS. And in Tanzania, every year, we have roughly 7,000 babies born who are infected with HIV and AIDS. But the situation is not the same in all the 26 regions in Tanzania. You've got some regions like Mbeya, like Jombe, like Iringa, where the burden is high. Dar es Salaam, where we sit, the burden is high in Dar es Salaam. Mwanza region, also high burden regions for obvious reasons, and also regions where prevalence are a little bit lower, so like Mtwara, like Lindi. So all in all, what I'm saying is that overall, the epidemic has decreased in terms of mortality, in terms of new infections, in terms of baby born, but it's still, with 1.7 million adults and children in this country, is still a public health threat, so that need to be attended in such a way that we can scale up the response and then end AIDS by 2030.
Thank you. Compared to other countries in the region, how would you explain that trend? Is Tanzania doing better than other countries?
When we go into the response, I'm looking at the trend. I think when we start digging into what has happened into the response, I will say in terms of decline in terms of mortality, as I said, okay, we're doing well in terms of reducing the number of people dying with HIV and AIDS as a region. So I've mentioned to you that the percentage of AIDS-related death, it's about 52%, and the average in the region is 48%. So that's very good. In terms of new infections, the average in the region, it's about 38% reduction, and we are at 23%. So depending on where we are in the treatment or in terms of the prevention, so there are areas where we've made progress, remarkable progress in the area of treatment, there's no doubt about it, but there are also areas where we need to work a little bit harder. Another area where I think we're we should also be accelerating the effort. It's around a domestic resource mobilization, but we'll get back into that, so into further place in the interview.
Okay, thank you. And we know that the UN is celebrating 75 years of its existence, and UNAIDS is a fairly young entity compared to other organizations within the UN. Your achievements in Tanzania, how would you define them and your relationship with the government?
I'm not sure you need, as an organization, to have been in existence, so for 50 years or 70 years, so to prove that you are relevant and then you are achieving good things. Okay, so I think we need to be mindful of that. Yes, you're right that UNAIDS is quite pretty young, so as compared to other UN agencies. But UNAIDS has been able, so to lead the global response. We've made progress globally in terms of putting people on treatment, a little bit more than 25 million people on treatment, reduce mortality, reduce mother-to-child transmission, and really we are optimistic that by 2030 we can end AIDS as a public threat. So we are really very happy. And more importantly, there's a lot that we have learned from the AIDS response that we can and applying, so to the current COVID response, so the overall health and development agenda. But coming back to your question, when it comes, so to where we are, what has happened in Tanzania, maybe we want to start by giving you a little bit some of the turning points in the AIDS response in Tanzania. I think one of the turning points in the AIDS response was in 1999 when Mzee Mkapa, His Excellency the President of late, so declared AIDS as a disaster, a public disaster, a natural disaster in Tanzania. And then ask each and everybody, so to know its status, promoting HIV testing. So I think that was a turning point. It was a turning point because as a result, we established, so TACAIDS. TACAIDS is the Tanzanian Commission on AIDS, under the office of the Prime Minister, tasked with leading a multi-sectoral response at the national level, but also at the subnational level. So I think that's something which was important in terms of turning point in the institution. What was also very important was the establishment of the AIDS Trust Funds, still under the leadership of Mzee Mkapa. The establishment also of the Parliamentarian Select Committee on AIDS, TB, and then the narcotic. Parliamentarians are very important people. They pass the laws, so they vote budget, and so on and so forth. So from the institutional point, that was very, very important. What was also very important in terms of turning point in the AIDS response in Tanzania has to do with setting up, so the necessary legislation and then the policies. So we can refer here to the HAPCA, which is the HIV and AIDS Prevention and Control Act, so in 2008, defining the entire policy and then framework, so what has to be done. So as a result, the UN supported the country to define the policies, the framework, put them in place, and so on, and so forth. So another important breakthrough which happened recently has to do with the amendment of the HAPCA. The HAPCA was amended, so to make sure that we can reduce the age of consent for testing, so for young people from 18 to 15. So I think that's a major achievement, making sure that younger people, so less than, more than 15, without the parenting consent, so could go and then have access to testing. So I think that was really very good. The amendment of the APCA also introduced PrEP, which is a pre-exposure prophylaxis. So it allows people, so who are engaging in risky behavior, so to swallow a tablet, it's called Truvada, so to reduce, so the risk of getting infected. And then the amendment of the APCA also introduced HIV self-testing. So now this is something that we should be able, so to use. People should be able, if they want, it's going to be implemented pretty soon, to making sure that people can get tested. Like you go in the pharmacy and then you buy a pregnancy test, or you buy a test, so that you can prick if you have diabetes to check your blood sugar. So these are really, in terms of institutional the turning point. So what has happened as a result really is that we've been able to scale up high impact interventions. I've mentioned 1.7 adult and children living with HIV and AIDS in this country. I'm happy to report that about 1.3 million as of June 2020 were on treatment. So this is a major achievement, having 1.3 million adult and children on treatment out of the 1.7. It's a major achievement in this country. And not only are they on treatment, they are taking, I would say, first-class treatment. So we've been able to roll out, so very efficacious regimen, using dolutegravir, so those are really very first-class molecule. And about 80% of our patients here in Tanzania are on dolutegravir. We've been able to set up also what we call differentiated service delivery models in such a way that people should not be coming to the hospital every month, so to get the medication. So now they are giving the medication, if they're stable, every 3 months. And our objective is to scale up, so in such a way that they can come every 6 months. We've reduced mother-to-child transmission. So that's, again, a major achievement that we've done. We've strengthened, so the network of people living with HIV and AIDS. We work very closely with NACOFA, with Tanzanian network of women living with HIV and AIDS, the adolescent network of people living with HIV and AIDS. We work very closely, with the youth organization. That's also something which is very important. And we've been able to work very closely with the government to ensure that they can increase the domestic contribution, and I can confidently say that year in, year out, the government is spending about 56 million US dollars. Well, it's still not enough, but I think taking in consideration the current environment, we're doing everything possible in such a way that government can increase its domestic contribution. And we've also have worked a lot, so in reducing stigma and discrimination, as UNAIDS in this country, we're really very happy and proud, so to have supported, so the government, so to scale up its response. You've asked our relationship with government. Our relationship with government, but also with non-state actor, it's excellent. So it is excellent. I'm happy to report that. We don't agree on everything, so as you will expect, we don't agree on everything. But our relation and engagement, it's good. We engage with government through TACAIDS. I've mentioned TACAIDS. The Ministry of Health, Community Development and Gender, we work very closely with them. Local government, TAMISEMI, work very good. Ministry of Education, I've mentioned the Parliamentarian Select Committee on AIDS, we work very closely with him. So that's the government. But we also work with civil society. I've mentioned NACOFA, I've mentioned the Tanzanian Network of Women Living with HIV and AIDS, the adolescent and young people living with HIV and AIDS, the Mkapa Foundation, AMREV, TAOYA, Aga Khan Hospital, so we have an excellent project with them, so on cervical cancer. We work with partners, so like PEPFAR, a Global Fund, Irish AIDS, Swedish Embassy, French Embassy. So really, other partners. We work with the media, and engagement, and then the relationship really has been great in making sure that we can scale up the response, that by 2030 latest, so we can make sure that we've made HIV and AIDS a history in this country.
I have a number of follow-up questions to what you have said, and it's really, commendable that you're doing a good job to help people who are living with HIV and AIDS. But I wanted to look at the challenges that people living with HIV and AIDS in Tanzania are facing now. A lot has transformed in terms of all the issues that you have mentioned here, but at the moment, would you define the challenges and what you as UNAIDS is doing to help these people in Tanzania? After that, I'll come back with a few
I think the challenge, thank you, very good question. So I think the challenges that people living with HIV and AIDS in Tanzania are not so different with what we see in other countries, and then also overall in the AIDS response. Specifically, I think it is important, the number one challenge that we face today in the AIDS response worldwide, in Africa, in Tanzania, that people living with HIV and AIDS face, it's a challenge of complacency and then maybe fatigue, that we do not have a problem anymore. So I think it is important, and UNAIDS is working very closely, very hard, to make sure that AIDS remains a priority for the government of Tanzania, and then it is high on the political agenda. It's still an unfinished business because it's not normal that babies are born with HIV and AIDS. It is not normal. We know that the people living with HIV and AIDS are on life-saving medications. If they cannot take, the antiretroviral drugs, so to make sure that they become virally suppressed, so live a healthy and productive life, and even reduce the transmission is not good. So really, number one challenge is that of complacency, and it is important that we re-engage the government and say it is unfinished business. It is important that we roll our sleeves, and then we really continue to scale up and sustain the gains. Number two challenge, it's about ensuring that the basic rights of the people living with HIV and AIDS, are protected. You still hear issues around stigma, issues around discrimination, issues around violence, so against, people living with HIV and AIDS, and keeping in mind that some of those people living with HIV and AIDS, are key populations. So you're talking about men having sex with men and gay men, we're talking about female sex workers, we're talking about people who inject drugs, and in many other countries, including Tanzania, those are behavior that are criminalized. So really the issues around protecting the human right is something which is important. Thirdly, I would say it is important that we reduce the vulnerability, the social and economic vulnerability and the inequalities, so that the people living with HIV and AIDS face, in ensuring that there are social protection mechanisms in place, so to make sure that so they can buy food, so they can buy their medications, so they can transport themselves into facilities, they can have a shelter, so they can start income generative activity here and there. So I think that's the third challenge from where I sit. And then maybe fourthly could be around ensuring that we support government to work towards increased domestic resources and the sustainability. 90% of the AIDS response in this country is funded by external donors, mainly PEPFAR and then Global Fund. It's good, so, but let's keep in mind that that generosity will not continue ad eternum, so if tomorrow those donors who are funding the AIDS response primarily to buy the drugs that the people living with HIV and AIDS, so are taking to stay alive, if you cut that supply, so it's a major threat, so for them. So while we appreciate, so the generosity, the support, the global solidarity, at the same time, we're working very closely with the government in such a way that we can find ways and means, so to increase domestic resource mobilization. We can find innovative ways, for instance, integrating, so the AIDS package in the National Health Insurance Fund. We're really working very closely with the government, with TACAIDS, in such a way that the AIDS Trust Fund that has been set, so can gradually mobilize resources, and that maybe, who knows, in the next 5 years, maybe reduce the contribution of external funding maybe from 90% maybe to 50%, and then gradually, so with the resources that the country will generate, so from the mining, from the cashew nut, for whatever it is, from the private sector, so that this country can effectively fund its response and achieve what Mwalimu Nyerere told us in 1967, about self-reliance in Arusha. So I think it is important, that, and in that, we engage very much with, of course, people living with HIV and AIDS. We engage with the parliamentarian. We engage with leadership at every level. We've developed the necessary equipment and document around investment case, around sustainability index transport, so that we can really advocate, so for a transition to a more sustainable. We work closely with the community, so sustainability is also at the community level in such a way that the government can own the response. So that's, in a nutshell, some of the key challenges that people with HIV and AIDS are facing.
Okay, on how COVID-19 is going to affect the relationship with HIV, in terms of the responses it is done, and also the relationship with donors.
That would be really, thank you. That's really a very good question. So I want to use the words of my boss, my executive director, so Winnie Bianima. We are seeing two epidemics colliding. We're seeing the COVID and the HIV epidemics, so really colliding. When things are colliding, especially where we are in the response, it should not be either or. You have to tackle both, so at the same time, and it's extremely, extremely important. It shouldn't be that we're reconverting the money that we have allocated to the AIDS response to now fund the COVID response. It would be a major, major, major mistake. Why? Because before even COVID struck, we were not on target, so to meet the commitment that we have made for 2020. We were off track. I've mentioned in the case of Tanzania that yes, in the context of treatment, we've done well, but we haven't done that well in the other areas where the world committed, so in 2016, in June 2016, and the high-level meeting on HIV and AIDS around the 10 fast-track commitment from the treatment, from the prevention of mother-to-child transmission, from the support to key population for young people, getting the community integration, and then the resources. So that's even before the COVID, we were not. So COVID coming with what you have said, so puts off again, there's a risk, so for us, so to be off track. So what we are saying from UNAIDS is that, one, there are a lot of lessons that we've learned from the AIDS response that we're already applying to COVID. We'll get to that. But what we're saying now, it is extremely important in the context of COVID that we try as much as possible to address both. Why? It is important to sustain those gains. COVID is killing, there's no doubt about that. But if all the attention is on COVID in terms of resources, if the demand of HIV services reduces because of the fear or because the services are not there, if we repurpose all the facilities and then the nurses, the doctors to address the COVID, if because of COVID there's disruption on the HIV services, it's definitely going to be terrible. It will take us back. All the gains that we have made, not only for HIV, but TB, malaria, will reverse the gain. Let me give you an example. There's a study from UNAIDS showing that if we disrupt the HIV services for 6 months, if there's disruption of the services because of COVID, so on the HIV services, it will result in an increase 500,000 deaths, 500,000 deaths. We've made great progress, so to reduce the number of deaths. So it will mean that in a country like Tanzania, which I've mentioned to you, so that the gains that we've made, I've said we're very happy to see the people dying because of AIDS, so number of people reducing. So if people cannot have access to the services because of the lockdown, because the medicine are not there, because of the human rights are violated, UNAIDS study shows that it will, in Sub-Saharan Africa, it will result in additional 500,000 deaths. Last year, we had about 690,000 deaths. So in 6 months, we are going to double that, all the gain that we've made. We also show, there's also evidence that if there's disruption of services because of COVID, where people cannot have access to condoms, or to all the prevention tools which are available, new infections are going to increase again by between 20 and 30%. The same evidence suggests that all the gains that we've made in reducing mononucleotide transmission, so we are going to go into an increase up to 150% in some of the cases. So what we are saying is that it shouldn't be the money for HIV and AIDS that you are taking to redirect to COVID. I know times are hard, but this is a time for us to show global solidarity, so while we are really supporting. So it would be a big mistake not to make sure that those gains, so from the AIDS response are sustained. So you've mentioned the lessons. What we have learned from the AIDS response, it's really that leadership is extremely important. And we're seeing the application of that leadership, so in the COVID response, so countries who have shown great leadership, so and saying we have a problem, this is a way to fix it, making people accountable. We're seeing, so the number of cases increasing, but also on the decrease. So leadership, we've learned that from the AIDS response. So that's something which is number one that we've learned. The fact that we've learned from the AIDS response that a multi-sectoral approach is something which is important. So when you're talking about hand washing, at the community level, so it goes beyond health, so you need other sectors to be involved. So the multi-sectoral approach that we've learned from the AIDS response is something which is extremely important, which is applicable, which is being applied, so in the COVID response. I saw it in West Africa when we have the Ebola Thirdly, we've learned from the AIDS response that the community is important at the community level, so when the virus is transmitting at the community level, so making sure that we engage the community, that the community understand what it is important, they pass on the message, they encourage people to get tested, and then help us do the contact tracing. So we've been using, in the case of Tanzania, in many other countries, our network of people living with HIV and AIDS at the community level, passing on the message, so helping to do the contact tracing. So thirdly, community, extremely important. Fourthly, we've learned from the AIDS response that it is important, so that we protect the rights of the people living with HIV and AIDS. So stigma, reducing the stigma and discrimination, the violence, the brutality will increase. We've seen with the COVID that because of the lockdown, we have had an increase of gender-based violence and also teenage-related pregnancies. So protecting the right of those who are vulnerable, it is important. We have learned that from the AIDS response, is still also applicable, so into the COVID. We have learned from the AIDS response that the evidence, it is important, so using data, so that you can disaggregate, so to see where those spots are. And we are seeing it. We're seeing it at a country level with the in the COVID. So yes, you may have a big picture, but breaking it down, so per region, per council, per quarter, it's something which is extremely important. We have learned also from the AIDS response that it is possible to mobilize ourselves at the global level to make sure that there's equal access, so to treatment, to testing. We've learned that from the AIDS response. So what our boss is doing is advocating in such a way that there's equal access to COVID vaccine when that time comes, that there's equal access to therapeutics when we have an efficacious drug, so from COVID. What we are also advocating is that the tools to diagnose, so are also available. But what are we seeing in terms of vaccine? Unfortunately, we are seeing already a situation where we don't even have a vaccine yet. And then those who have the money, so are already booking, so there are millions of billions of vaccine that are not even yet produced. This is not acceptable. So it should be equitable access to each and everybody. And what we are also saying is that, yes, this is a health crisis, but it is also a social and economic crisis, talking about COVID. So you cannot delink the two. So while you are addressing the health crisis, when the lockdown are being eased, how can we address and mitigate the social and economic impact, which again, because of the vulnerability, because of the inequality, the impact is going to be terrible on those who are already vulnerable, including the people living with HIV and AIDS, the adolescent girl and young women, so those living in the slums and so on and so forth. So let's use this opportunity to see how we can have a new stimulus packet, so how we can cancel the debts, so why not in such a way that we can jumpstart our economy. So what I'm trying to say here is that it's not COVID against HIV. It's both at the same time. If we put too much attention on COVID, we'll be losing the gains. More people will be dying because of TB, because of malaria, because of HIV, because of the children not being immunized, because of women not being able to go into hospital, and then deliver. Yeah, I think it's something which is important. We need new money, so that's important. There's a lot that we've learned from the AIDS response that we're already applying, so into the COVID response, and it's a health crisis, but it's also a social and economic. It's about life and livelihoods. You cannot choose life and then livelihoods. You need both at the same time. It's time for solidarity, but also share responsibility. The epidemic in Sub-Saharan Africa is still mostly transmitted through unprotected sex. So the sexual transmission of the epidemic is still very predominant in Sub-Saharan Africa. So you get infected because you have sex, unprotected sex, with somebody which is infected. So when you put yourself in a place like Tunduma, the border with Zambia, and then you see all those trucks which are going back ahead. When you see all those sex workers around selling sex, so
it's because of the highways.
You're looking at the highways, so you're looking at the cross-border, you're looking at people coming and selling sex. You're also looking at the vulnerability. People sell sex because, so they've got nothing to do, okay? You're also looking at the behavior, a lot of people, what you see, for instance, it was mentioned, the ones and then in the mining, so there's a belief, so that because before you go to sea, so the kind of risky behavior which is coupled with the belief, which is coupled with sometimes alcohol consumption, which is also, you also see that belief in some of the mining sectors, so that if I have unprotected sex, so a lot of sex, because, so it all has to do with the knowledge, the behavior, and then also keep in mind that maybe in those areas we haven't done enough. I would not say about awareness raising. People have heard, people know, but awareness raising and behavior change, it's something which is important. Okay, look at Dar es Salaam. Dar es Salaam is almost 6 million people, so it's urban. So I think this is something, these are some of the factors that make sure, even when you are in the Lake Zone region, so see how people are mobile there. People move from Kenya, Uganda, Rwanda, DRC, whatever it is. So whatever will bring people to mix together, to have unprotected sex. You may also argue that are the commodities available? I'm talking about condoms, so are people aware? Do they know where they can go and have condoms? So those are some of the factors that will contribute, as you rightly say, in such a way that urban cities where there's density, where there's promiscuity, where there's overcrowding, those are factors, so that will lead, that contribute, so to the spread of HIV, TB, and even COVID that we're talking about. Now, you've mentioned PrEP. PrEP, it's very true. PrEP is pre-exposure prophylaxis. So the reasoning is, if I'm engaging a risky behavior, so I can be taking that tablet, so on a daily basis, so that will prevent me. I want to commend the government of Tanzania, so they've not everybody will have access to PrEP, so we need to be mindful of that. It's not very, not many. So government has conducted some pilot phases, in selected regions. This being completed, and then now there's a target to making sure that maybe in this year about 180,000 people will have access, so to PrEP, so before you go into PrEP. So those are, who are those who are eligible? Discordant couple, so I'm in a couple, I'm positive, the other person is negative, so that they're eligible for PrEP. Who also are eligible, key population, female sex workers, men having sex with men, people who inject drugs, they're eligible for that. Pregnant and breastfeeding women, okay? Because what we are seeing now in the epidemic in Tanzania is that most of the women would get infected after, so after delivery. So it's after the delivery, because the husband or the partner got engaged into other relations and then came and infected. So pregnant and breastfeeding women will have access. I've mentioned the discordant couple, adolescent girl and young women, so also because what we are seeing in Tanzania is the face of the epidemic is that of the adolescent girl and young women, so about 25% of new infections occurring in the age group 15, so 24. Why? Because the knowledge is not there. um, they are vulnerable and they get infected with older men. So those are the groups, so who would be eligible, so for PrEP, and we really want to commend, so the government for doing that. The other question that you asked was on
the project that you're doing.
With Aga Khan. Aga Khan, it's about cervical cancer. So cervical cancer, as you know, cervical cancer in developed countries, cervical cancer is something which does not kill women that much. So because the screening, there can be early detection, and then there can be early treatment. So what we also know is that when a woman is HIV positive, it will increase the chances for an HIV positive woman between 3 to 5 times, so to acquire cervical cancer. So you want to avoid the situation of being a woman, being HIV, and then have cervical cancer. So we want to reduce that. So what we have done, President, through the Pink and Red Reborn initiative, it's an initiative that was introduced by President Bush. He came to Tanzania. Tanzania was one of the selected countries. I think it's President J.K. Kikwete who was then president. So the initiative was launched here. It's an initiative that aims at raising awareness, such a way that people are aware, so that it's something which is in existence. It is an initiative that aims at making sure that those at risk, above a certain age or above, or HIV positive, can get screened. So the screening is very easy, so we use vinegar, so to visualize the uterus, and to see whether the lesions are there. So it's about raising awareness, it's about screening, and if you are found positive, it's about starting a treatment. So treatment can be done at the local level, or treatment also can be referred, if it unfortunately it's a more advanced stage, in facilities like Aga Khan. And cervical cancer is number one. Cervical cancer and breast cancer are the number one cancer among women of reproductive age in Tanzania. So what we have done is using that community component around the cervical cancer. We're working with women living with HIV and AIDS, the Tanzania Network of Women Living with HIV and AIDS, getting the community involved, creating awareness. Is that component that now we're partnering with the Aga Khan Hospital. We've been able to link them up with the French government, so the French Cooperation Agency, the AFD. So some resources have been provided, and then they're starting a pilot project, sorry, in Dar es Salaam, and then I also think in Mwanza. We have also been able to mobilize some resources from the Global Fund and working with THP Plus, and Dr. Redamta, in also making sure that in other regions of the country, women can be informed, they can be screened, and they can be tested, because it's the number one cause, of cancer among women of reproductive age in Tanzania. We should also commend the government. Government also have started. Cervical cancer is caused by a virus, which is called HPV, human papilloma virus. So I think government, Ministry of Health, in collaboration with the Ministry of Education, they also have started a good program in Tanzania in vaccinating, so young girls, so in school. And I understand that the turnout, the contribution is really good. So while, and why is UNAIDS doing that? Because as I said, gradually we should be moving towards integration. So when you see one person, so you need to be able to see HIV, but you also need to see hepatitis, you also need to see syphilis, so you also need to see blood pressure. So it should be integrated. It works. it is cost effective, and it's efficient. Again, we have learned from the AIDS response that leadership, that community engagement, that negotiation, so to have people at the center, it's something that we can apply on the cervical. So the relationship is really very good with the Aga Khan, specifically the cervical cancer component. I really think, from where I sit, that the government has made, with the support of the development partners, including the UN, so government has really made good progress, remarkable progress here in the AIDS response. There's really no doubt about that. I gave you the number of people we know the number of people who are on treatment, and the country is very close, so to achieving the UNAIDS 90, 90, 90. So government is really very close, so, and we are sure that by the end of this year, so government will have achieved, Tanzania will achieve the 90, 90, 90 treatment target. There's really good progress, so on this, and after the 90, 90, 90, we'll be moving to 95, 95, 95. And I'm sure that by 2025, the country will have reached the 95, 95, 95. So really good progress on the first zero, which related to AIDS-related death, in testing people, putting them on treatment, and making sure that they are virally suppressed. So really good progress. Some progress on the second zero, which is the new infections. Okay, new infections have declined, but they have not declined enough. I've mentioned a target of 75%, but we're barely at 25%. So it is important that as we identify people who are infected, putting them on treatment, and making sure that they're virally suppressed, we still have primary prevention. We say in medicine that prevention is better than cure. So it is important, so that we strengthen our prevention, especially the prevention among young people, adolescent girls and young women, and the key population. It is also important that in terms of prevention, we make sure that no baby is born with HIV and AIDS in Tanzania. It is possible. You're only talking about 7,000, so if you divide that by the 26 region here, it's less than 300 babies per region. So this is an area where, so we really need to continue to work very hard. Lastly, where there hasn't been enough progress, it's around stigma and discrimination. For that to happen, for us to say we're getting into ending AIDS, so the leadership has to continue. We don't need to be complacent. The multi-sectoral approach has to continue. There's no doubt about that. The community need to be engaged. There's no doubt about that. We need to generate better information. We need to improve the legal, social, and political environment around stigma and discrimination, making sure that not only the people living with HIV and AIDS, but the key and vulnerable population, that their rights are protected. Last but not least, we need to work very strong to making sure that we increase domestic resources in such a way that when there's no international support anymore, this country will transition towards sustainability. If that is the case, and based on what we saw recently, we saw Tanzania recently achieving the middle income status, which was planned for 2025, achieving it 5 years before. So who knows, maybe the target of 2030 for ending AIDS, maybe Tanzania will be there, so by 2025, who knows? I'm really very happy as UNAIDS, as part of the system, so in interacting as a team, engaging government, engaging the community, engaging non-state actor, private sector, and partner. So I think it is possible. Yes, we can. It is possible here. And I'm very happy to be part, so of that success. I'm very happy on behalf of my organization, to have contributed to those progress. We remain very, very committed. Ending AIDS is possible, and we should be able to end AIDS while we prepare, while we use the infrastructure that we're doing for the AIDS response to address Ebola, to address COVID, and any other health emergency.